Hi, I'm Marlene Boas. I've got a PhD in psychology and I'm a life coach. Everyone's type 2 diabetes story is different, and no one should ever feel confused, alone, or unsure of where to find more information. That's why I partnered with the makers of Ozempic to teach people and empower them to transform the way they manage their diabetes. Here are my 5 steps for overcoming setbacks. But before we get started, there are some things you should know about Ozempic.
Ozempic is an injectable prescription medication used along with diet and exercise to improve blood sugar in adults with type 2 diabetes and to reduce the risk of major cardiovascular events such as heart attack, stroke, or death in adults with type 2 diabetes with known heart disease. Do not share needles or Ozempic pen with others. Don't reuse needles. Sharing may lead to infection.
This video is not medical advice and does not replace the advice given to you by your doctor. Talk to your doctor if you have concerns about managing your type 2 diabetes. Step 1, get honest. Eating too much, not exercising regularly, it's going to happen. This journey is not always easy. Keeping yourself honest may help you break the bad habits and remind you why you're working toward lowering your blood sugar. Step number 2, recommit to your why and anchor. If you start finding yourself stepping off the path and you need to find your way back, reflect on your why. Think of your anchor, hold on to that, get your bearings, and get back on the path. Step 3, address setbacks. Maybe you've gotten off track, not eating right, not exercising regularly. It happens, you're human. We want to look for going in the right direction, not perfection. So get back on course as soon as you can, because that's what's going to make a difference. Step 4, what did you learn from your setback? Think about why you got off track. Was there a specific trigger? How did you react? Take some time to identify why you had a setback and write it down. Don't beat yourself up about it. Learn from it. And then treat yourself with loving kindness, because that will help you be successful on your journey. Step 5, take what you've learned from step 4 and use it to create a personal action plan. Think about how you're going to prepare yourself for future scenarios where triggers can occur. Then you can use the when, I will, and because tool to help you. This is one of my favorite tools. The when could be when you face a setback, like eating poorly for a week. The will is, what will I do to work toward overcoming that setback? Your because is the anchor, the reason why you're working towards overcoming the setback. Use your why, your anchor, and reference your personal action plan to overcome future setbacks. I'm rooting for you to succeed, and in order to do that, you're going to have to accept that setbacks are part of transforming the way you manage your type 2 diabetes. Visit mytype2transformation.com now. Get access to videos and downloadable flashcards to help you transform the way you manage your type 2 diabetes. Don't get discouraged. Just remember, setbacks are normal, and try to get back on course as soon as possible. Good luck. You can do it.
Learn more about how once-weekly Ozempic may help you lower your blood sugar at Ozempic.com and ask your healthcare provider if it is right for you. Continue watching this video for important information about Ozempic. Ozempic is not for people with type 1 diabetes or children under 18 years of age. Do not take Ozempic if you have a personal or family history of medullary thyroid cancer, multiple endocrine neoplasia syndrome type 2, or if you are allergic to Ozempic. Stop taking Ozempic and get medical help right away if you get a lump or swelling in your neck or an allergic reaction. Serious side effects may happen, including pancreatitis. Stop taking Ozempic and get medical help right away if you get severe stomach pain. Gallbladder problems may occur. Call your provider if you have symptoms such as stomach pain, fever, or yellowing of the skin or eyes. Tell your doctor if you have diabetic retinopathy or vision changes. Tell your doctor if you are pregnant, plan to become pregnant, or are breastfeeding. Taking Ozempic with a sulfonylurea or insulin may increase the risk for low blood sugar. Talk to your doctor about how to prevent, recognize, and manage low and high blood sugar. Common side effects are nausea, vomiting, diarrhea, stomach pain, and constipation. Talk to your doctor about any side effect that bothers you or does not go away. Some side effects can lead to dehydration, which may worsen kidney problems. Drinking plenty of fluids may reduce your chances of dehydration. Stay on your prescribed diet and exercise program while using Ozempic. If you're not reaching your blood sugar goal, ask your healthcare provider if once-weekly Ozempic can help.